Hello everyone, welcome to World Nursing Lecture Room. So whether you are a first time mom or you are a first time parent or you are adding a new little one to your family, preparing for the baby is one of the most essential part and most exciting and life-changing journey in a lifetime. So in this video, I will guide you step by step through everything you need to know, from setting your home, from packing your baby bag or hospital bag, emotional readiness, financial planning. So my dear, grab your notebook, grab that notebook, sit down, relax. We are going to take you through step by step everything that you need to know. Get ready, get ready to welcome your bundle of joy with confidence and love. So get ready into this video also. And if you have not subscribed, let me look at you very well. You are in this channel and you have not subscribed. Subscribe, like the video, share, comment. Don't forget to turn on the notification bell so that every time I post a video, you will be the first person to be notified. So guys, make sure you are with us. Check your notebook. So because we are going to talk about very important things for moms, for those who are preparing to get their baby girl. So what you need to know when you are preparing for the baby is, okay, let's start with prenatal care. Make sure you attend all the clinic because that is the place you will get a chance to ask questions for everything that you don't know. If you have been given the vitamins, the folic acid, the medication, the prophylaxis medication, make sure you take those medication. Eat a well-balanced diet, my dear. Hydrate well. We said you have to take 8 to 10 glasses of water. What is wrong with you? You have to take 8 to 10 glasses of water. Avoid harmful substances such as alcohol and some medication. You are pregnant, you are carrying a life, your life is at risk. Stop taking alcohol, stop using tobacco, stop using bang. Those drugs are dangerous for you, for your health, and for the baby. So for the prenatal care, make sure you attend all the clinic. Everything that you have been told in that clinic, make sure you follow them to the letter. Follow all those things that you have been told to do in antenatal clinic. Follow them well. If you're being told to take medication, make sure you take those medication. It is very important. They are helping you, or they are helping to prevent prenatal deformities, malformation, and also they are helping you in terms of boosting your blood. So make sure you take those medication. Number 2, let's go to birth plan and delivery. I said you take a book, write all these things so that you know how you are dealing or what you are expected to do when you are pregnant. Choose a healthcare provider and a delivery facility. Make sure that you know a nurse who is your best friend. Tell that nurse, you will help me to deliver this baby. Tell that doctor that I will come to your hospital and you help me deliver this baby. And if you don't have anyone who is in healthcare provider, who is in health sector, just take yourself to the hospital. We have so many doctors, so many midwives, so many nurses who are well trained. Those people are well trained. Tell them or tell one of them that you will help me during my delivery. Choose a facility. Do your research. It is important that you do your research. Which facility is best for you? You know, we have some facility which, it is true, we have to say these things. We have some facilities which those people who are there, those nurses, those doctors are very they are rude. They neglect patient. They have a lot of cases in court, bad cases. They have so many bad or negative comments. So don't go to those hospitals. Go to best. You are carrying a baby, you are carrying a life, you are expecting a bundle of joy. So do your research. Get a nice facility where people are on toes, so that you avoid so many complications when you are going to deliver. Decide a delivery preference. In Kenya, I don't know if we have epidural, but if you are in other countries, they usually have epidural. So choose your delivery preference. Is it natural? Is it CS? So okay, when you're choosing your delivery preference, be flexible and know that anything can happen. So when you are advised that maybe we have done epidural and your baby is at risk, so you have to go for CS, make sure you are flexible and you adhere to doctor's instruction. Pick a hospital bag from 35 weeks with essentials like baby's clothes. We said you have, when you are second trimester, go and know the gender of your baby, and you start buying clothes according to the gender you are carrying. So at 35 to 36 weeks, make sure your hospital bag is ready. Make sure you have the baby clothes. You have bought everything, baby's clothes, maternity pads, phone charger, you will need to carry it, documents. Some people usually forget the antenatal book or the documents that you were written, that you had when you were during your pregnancy time. So make sure you don't forget those essential documents, your national ID, your passport, everything that you will need when you go to the hospital. Toiletries, carry those things. Make sure you have packed everything in that hospital bag, anything that you will need, so that when you go there or when there is an emergency, you just tell the person responsible to pick your hospital bag. Not that when there is emergency is when you start running up and down, you did not buy anything you want. It is not right. It is not right, guys. Okay, make sure you have those. When you're preparing the baby essential, prepare for the basic things: the diapers, the wipes, the slippers, the socks, the mittens, the receiving blanket, the towels, the basins, baby bath item like soaps, yeah, feeding supplies, bottle formulas, breast pump if needed, if you will need those ones. You pack those things, my dear. Make sure you buy them as early as possible, and you pack those essential. Okay, for home preparation, clean and baby-proof the house. Set the nursery and sleeping area. Most of the time, I usually see this thing being done by the whites, and some homes which are well off, where you find that when a mother is pregnant, they prepare for the nursery, the sleeping area. But in Africa, we are poor. We are poor. You don't even buy a baby coat. You don't even buy clothes for the baby. So for home preparation, organize baby items where they are accessible, because after delivery, sometimes you are tired and people who will be helping you, give them easy time. So when they want a diaper, when they want baby clothes, they are easily accessible. So those are the things that you need when you are preparing for the home. Emotional and mental readiness. Talk with your partner about rules and expectation. Join parenting or prenatal classes whenever they are available, or whenever you find one. Rest and reduce stress. Your mental health matters. So when you need to talk to someone, go to healthcare provider, tell them what is disturbing you. Talk to people around you, yeah. Tell them what you want. Tell them how you want your baby to be received, yeah. In financial planning, budget for the baby related expenses. Review health insurance for maternity and pediatric coverage. Consider starting a saving plan for emergency and future needs. So sometimes you might get that you had all the financial planning, and you did not set aside money for emergencies. Like for example, maybe there is an emergency and you need to call for an ambulance. That is money aside, yeah. Also, some hospital, they don't allow these Linda Mama, this SHA, whatever, I don't know how you call it in your country, this maternity insurance. Some hospital, they don't allow you, especially if you're going to deliver in private hospitals. Then this government insurance, they will not allow it. So make sure you have the money for emergency and for future need. Identify people who can support you. Those are your family member, your friends, yeah, your spouse. Don't hesitate to ask for help in case of anything, or even after birth, yeah. Don't hesitate to ask for help. And most important thing, know the signs of labor. Learn the different types of labor. We have the true labor and the false labor. We will talk about that, yeah. We will talk about false labor and true labor. So know the difference between true labor and false labor. Know when to get to the hospital. Contraction usually are about 5 minutes apart, lasting 1 minute for an hour. That is just let's say it's rule number 511. Yeah, rule number 511. Usually when contractions are 5 minutes apart, lasting for 1 minute for a period of 1 hour, you are ready. You start your journey to the hospital. So those are the things that you need to know when you are preparing for the baby, yeah. When you are preparing to welcome a bundle of joy in your family, you have to know all those things that I've talked about, yeah. Baby essential, yeah. Emotional readiness, the hospital, the prenatal care, the emergencies, what you will need after delivery, immediately after delivery, what you will need, the people they will contact, the people who can help you, financial readiness, your support system, no signs of labor. Those are the things that you have to know, yeah. Those are some of the things that you have to know, and you have to be well conversant with them. So I think I'm going to stop there. If you have not subscribed, subscribe, like, share, comment. If we get to 1,000 subscribers, I'm going to give 1,000 Kenyan shilling each for the first 10 people who will comment in the video that will, in that video, for example, if this video we will get to 1,000 subscriber, then I will give 1,000 to 10 comments. Yeah, to 10, the first 10 comment I will give 1,000 Kenyan shilling. Is that a good deal? So let's get to 1,000 subscribers, my dear. Let's get to 1,000 subscribers. So bye till next time.